So what types of prebiotics do you like, and do you supplement with butyrate?
Yes. So there's a couple of ways. You can do that. So I really do prefer using prebiotics rather than using probiotics. There are a couple of cases where I will use probiotics. I do like that Saccharomyces cerevisiae. There's several companies that make it. Mm-hmm. And using that specifically when I have to give antibiotics for something, mm-hmm. I'll give a few days of that. And sometimes that alone will do the trick. I really try to limit the number of days I feel like I have to give antibiotics, but sometimes you don't have a choice. So I will definitely will give patients butyrate, and I can give that in one of two ways. There's several ways, but the two main ways are either by giving a rectal butyrate infusion, and your compounder, your local compounding pharmacy can do that for you. It sort of depends on how severe and how long this disease process has been going on. And so if it's been, let's say it's an ulcerative colitis or Crohn's disease patient who's had this disease process for a while, let's say they had a recurrent strep throat infections when they were a child, so they took antibiotics, every 2 or 3 months for 2 or 3 years as they were a child before they had their tonsils taken out. And so they've been dealing with this for years and years and years, and now we get to a place where we can treat them. I'm probably going to start with a rectal butyrate infusion. You can give them, there's a couple of companies that make a bioavailable butyrate that's orally available. Mm-hmm. One is Probutyrate by Tesseract. I use that a good bit.
Tesseract, okay.
And I like that combination. So using both the butyrate, either rectally or orally, and then using a good quality prebiotic. Mm-hmm. And so there's a couple that I like. Designs for Health makes Paleo Fiber RS. Bimuno uses that daily. That one is a really good one. I really like that one. Mm-hmm. There's several. I really like the hot chocolate cocoa ringa that's made with moringa. It has 6.7 grams of fiber, so that's a pretty high amount for a powdered fiber source, and it's delicious. You can put it in your coffee. So I love to do the combination of those two, butyrate plus prebiotics, to mm-hmm. see if we get that colonocyte to work again. And so especially if you have patients who are chronic diarrhea or chronic constipation, those may be good choices for you to use to get their intestines back in balance. It sometimes takes 4 to 6 weeks, especially if they've had it for a while, for them to see a big change in that. And you may need to add other anti-inflammatories just to help the cells calm down from this inflammatory storm that's been going on. So there's all kinds of things you can do. Fish oil can help, and anything that you would normally do to decrease inflammation, low-dose naltrexone, pentosan, anything that you would use to decrease inflammation in a cell or in a cellular milieu, that's going to help the cell to be able to function optimally. So that you could add all of those things too. But just specifically for what we're talking about, I would probably use, I probably number 1 and number 2 use Bimuno and Probutyrate by Tesseract.